Heart failure affects roughly 6 million Americans, but now there's a new drug that is making waves, and it could be a game changer. Dr. Kevin Campbell here this morning with more. Doc, good to see you.
Good to see you, Phil.
When we're talking about heart failure, specifically congestive heart failure, what exactly is congestive heart failure?
Congestive heart failure is when the heart no longer functions normally. Your heart's a pump, and it has to pump blood to all the major organs and arteries in the body. And what happens in congestive heart failure is the pump fails, and fluid backs up into the lungs, into the legs, so you'll have swelling in your lower extremities, you'll be short of breath, and you can't lay flat at night in some cases.
What are some of the signs of CHF?
Well, the most important thing that we notice is swelling in the ankles. We also notice that patients can't lay flat, they have trouble walking across the room, they get very short-winded, and it really can significantly impair your ability to function. In fact, congestive heart failure accounts for almost $45 billion worth of healthcare expenditures annually.
This new study, this new drug, where is it? Has the FDA approved it? And when might we see it on the market if it has not approved it yet?
This new drug is amazing. It was presented at the European Society of Cardiology meetings last week.
Right.
And what we found was this drug reduced risk of death and hospitalization from congestive heart failure by 20%. The drug doesn't have a name yet, but the data is so powerful that was presented this week. It's going to go before the FDA, and I would expect within the next 12 months we're going to see this drug on the market. It's going to be a game changer.
Yeah, why is that? How is it going to change things?
I think that when you have a drug that can keep people out of the hospital with congestive heart failure, and certainly anytime we can reduce death by 20%, it changes the way we will treat. I think that right now we see all our patients on a good set of medicines. This drug will add to that armamentarium that we have to fight this disease.
Every little bit helps, right?
It sure does, especially when you have heart failure.
Absolutely. Dr. Kevin Campbell, thank you for being here this morning. If you have a question for Dr. Campbell, log on to our website, WNCN.com. Hit links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page and even hit him up on Twitter.